And while we're getting the slides teed up, I can begin with some introductory information. Again, we'll be talking about the 2024 call for proposals with the Robert Johnson Foundation Systems for Action Research Program. This call for research proposals was released last month, back on December 13th, through the Robert Johnson Foundation webpage and a variety of other communication channels. So hopefully you all have found your way to that information. If not, we'll be sharing with you links and other resources today that will be helpful as you begin to understand this funding opportunity better, and hopefully many of you beginning to prepare applications and proposals in response to this proposal, to this call. So there we go. We've got the slides up. And thank you so much, Carrington. So our agenda for today, I'll be talking through an overview of the Systems for Action Research Program, and then moving into specifically details of the 2024 call for proposals. We'll talk about the focus of the research. We'll talk about some special topics of interest and some characteristics of proposals that make proposals likely to be successful under this call. And then we'll talk through some of the details about how to apply in the application process for this call, which is a little bit different from the process we've used in previous years. And then toward the end of our hour together, we will have some time for fielding questions from you all who are with us on today's webinar. And so we'll get to as many of those questions as we can today, and any that we don't answer by the end of the hour, we'll be able to communicate with you after the webinar via email and answer any other questions you might have. So we can, just a few housekeeping issues. We are recording today's webinar, and we will be posting that recording along with the slides that we're using today to everybody who's registered for today's webinar, and we'll also post that material up on the Systems for Action website at systemsforaction.org. Everyone during today's webinar will be muted. We've got several hundred folks with us today. So when we get to the Q&A portion, you won't be able to vocalize your question, but you can submit your question at any time using the Q&A box that you should see, the Q&A icon down at the bottom of your screen. Click on that icon, type in your question at any time as we go along today. And again, we'll get to as many of those as we can during the latter part of our hour today, and also answer any other questions offline that we don't get to. So just some additional introductions. My name is Glen Mays. I have the privilege of serving as the director of the National Program Office for the Systems for Action Research Program. That program office is based here at the University of Colorado in the Colorado School of Public Health. And the program overall is led by some very talented leaders at the Robert Wood Johnson Foundation. Their pictures are shown at the top of this screen. They include Carolyn Miller, a senior program officer, Dr. Isabel Cuervo, another program officer in the Research Evaluation Learning Division, as well as Leah Carey, a program officer in that Research Evaluation Learning Division as well. And then those of us working at the National Program Office in Colorado, I'm fortunate to have a number of very talented people to work with, colleagues here whose pictures and names and titles you see here at the bottom part of the slide. In particular, I'll give a shout out to Carrington Lott, our Deputy Director, as well as Sadina Belmashkin, who's our Program Manager, and Julie Reslam, all of whom are with us on today's webinar and who will be helping me, especially during the latter part of our webinar, our hour today, when we're fielding questions. So some great colleagues to work with here in our program. So the Systems for Action Research Program was a signature research program created by the Robert Wood Johnson Foundation back in 2015. And it was one of the research programs created to help the foundation build evidence toward their culture of action framework. And Systems for Action, our focus is conducting rigorous research to help us learn about strategies that are effective for aligning medical care, public health, and social services systems, specifically helping those different systems align their efforts, align their work in ways that can improve health and well-being, and especially advance the cause of health equity. So in short, we're studying new ways of helping medical, social, and public health systems work together to advance the cause of health equity, to dismantle structural racism and other forces that produce and sustain inequities in health across American communities. We invite you to explore more about our program on our website at systemsforaction.org. On that website, you can get access to our research agenda. You can see descriptions of the kinds of studies that we've funded in the past. And again, we've been up and running since 2015 and have conducted annual call for research proposals over that period beginning in 2016. And so encourage you to spend a little time on our website getting to know Systems for Action a little bit better. That takes us to the current call for proposals, the 2024 call for proposals. This is a call that we published again on December 13th. And the focus of this call, we are looking for new proposals for new research that focus on strategies for disrupting and dismantling the health effects of systemic racism, and particularly forms of systemic racism that operate through and within medical, social, and public health systems. So specifically, we are hoping to see proposals that will identify an innovative strategy for helping medical, social, and public health systems align their efforts toward the common goals of disrupting and dismantling forms of systemic racism. We call those innovative strategies that are tested through studies in S4A alignment strategies for helping medical, social, public health systems align their efforts. So for this call, we're looking for proposals to test innovative alignment strategies that focus on disrupting and dismantling forms of systemic racism. There are two categories of awards that are available through this 2024 call for proposals. So you can choose to apply to one of these categories of awards. Category 1 is called the Developmental Studies category, and this is designed to support earlier stage preliminary research, studies that are designed to test the feasibility and acceptability of an innovative alignment strategy designed to disrupt and dismantle forms of systemic racism. This is a great category for conducting initial pilot testing and feasibility testing of a new alignment strategy that you've identified, but haven't yet had a time to test for implementation feasibility. Category 2 is for we call impact study awards. This category is designed to support larger studies that will estimate the impact and the effectiveness of the alignment strategy in disrupting the health effects of systemic racism. And we'll talk more about the specifics of each of these two categories of studies in a moment. They're also described in greater detail in the funding opportunity brochure, which we encourage you to spend some time with. The final bullet of the slide is all of our studies that we fund under Systems for Action are expected to have robust research translation activities that are designed to help relevant community partners use the results from the study in their own settings to align medical, social, and public health systems beyond the study sections. So in a broad brush, this is the focus for our 2024 call for proposals. Again, a little bit different from the CFPs that we've released in previous years, if you're familiar with those. Again, an overarching focus on system alignment strategies that have the potential to disrupt and or dismantle forms of systemic racism that operate through and within medical, social, and public health systems. There are several special topics of interest that we've identified within this larger call for research, and I'll describe these briefly in the next couple of minutes. They're also described in greater depth in the funding opportunity brochure, specifically on pages 2 and 3 of that brochure. So I will call your attention to those pages. The first special topic of interest we're showing on this slide relates to studies that are designed to help us understand forms of systemic racism embedded in medical, social, and public health systems. So these studies should improve our understanding about specific forms of systemic racism that operate within or that affect medical, social, and public health systems. And these studies should be designed to fill important gaps in scientific knowledge about those forms of racism and how they operate, and especially how to disrupt them. So studies under this special topic, again, they should focus on a specific form of systemic racism where we have insufficient evidence about that form of racism and how it operates. The study again should identify important gaps in scientific knowledge and lay out how those gaps will be addressed by the proposed new research. As the third bullet on the slide shows, if you're submitting a proposal under this special topic, you want to make sure that your proposal covers a couple of key components. First of all, describing how the forms of racism that you're studying, how they what's currently known about how they operate and persist within and across medical and social and public health systems. You want to describe how your study will quantify the impact of those forms of racism on the health and well-being of affected populations. And then third, and very importantly, you want to describe how your proposed study will explore potential pathways and opportunities for dismantling or disrupting those forms of racism and their health effects. So that's special topic number one. A second special topic of interest is described in our CFP relates to studies that examine ways of addressing resource inequities across systems. So these studies should evaluate novel strategies for equitably allocating and sharing resources across medical, social, and public health systems specifically in order to support collaborative solutions to systemic racism. So we're focusing in on, again, resources and resources sharing. Studies can focus on solutions to forms of systemic racism that make it difficult for minority communities and minority-serving institutions to secure sufficient and equitable amounts of funding or staffing or other resources that they need to meet community needs and address forms of systemic racism. These studies under this special topic may also test novel financing mechanisms or novel payment models, novel staffing models and staff sharing models, and other forms of resource sharing, again, that can help medical, social, and public health systems work together to address forms of systemic racism that operate within their systems. Finally, studies that are proposed under this topic may also test solutions to what we call wrong pocket problems that arise when you have collaborating organizations in medical, social, and public health systems, but where the costs and the benefits of that collaborative work are distributed unevenly or in unequitable ways across those collaborating organizations. And so, again, studies under this topic number 2 may also relate to that wrong pocket problem and might test solutions to that wrong pocket problem through more equitable resource sharing arrangements. So that's topic number 2. Finally, special topic number 3. Under this topic, we're interested in studies that will test ways of strengthening the voice and authority of marginalized communities in system alignment strategies. So under this topic, we are especially interested in studies that can evaluate strategies, again, for strengthening the voice and the influence of marginalized and racialized communities within medical and social public health systems and within how those systems operate and how those systems work together to address forms of systemic racism. So, for example, studies proposed under this topic area might test novel governance models, such as looking at who's represented on the governing boards of boards that operate within medical, social, and public health systems. They might test novel community deliberation and decision-making mechanisms. They might test things like participatory budgeting strategies or novel approaches to public reporting and community engagement or public disclosure requirements, or other types of innovative ways of positioning marginalized communities into greater positions of influence and authority, oversight, and accountability within medical, social, and public health systems. In this topic area as well, we're also especially interested in studies that can include a focus on engaging people with lived experience related to systemic racism in developing solutions to those forms of racism across medical, social, and public health systems. Again, each of these three topic areas are described in greater depth on pages 2 and 3 of the funding opportunity brochure. Just a few points about key characteristics of successful proposals under this call. All proposals that will likely to be successful in this call should focus on engaging all three of the sectors that are of broad interest in the S4A program. That is the medical care sector, the public health sector, and the social services sector. And so, again, we're looking for proposals that can engage and align representatives from all three of those sectors in the system alignment solution to forms of structural racism. We encourage you to take a look at how we define each of those three sectors: medical care, public health, and social services. You can see those definitions. They are broad and inclusive, but you can see those definitions in our FAQ page on the Systems for Action website. Proposals should also include a clear and convincing logic model describing how your proposed system alignment strategy will address health equity problems and work to dismantle or disrupt the forms of systemic racism that you describe in your proposal. So we're again looking for a strong logic model for how your alignment strategy has the potential to realize success in disrupting and dismantling forms of systemic racism. This is a research program, and so a successful proposal should also describe a rigorous and clearly specified scientific research approach for studying either the implementation of the alignment approach or for studying the impact of the alignment approach if you're applying for that impact award category, covering aspects like the overall research design, data sources, measures, and analytic methods that will be used. Also, very importantly, the Systems for Action program places a lot of emphasis on studies that can measure and achieve system-level change, actually change how systems operate in medical care, public health, and social services. And specific to this call, a focus on measuring and achieving system-level change in dismantling or disrupting forms of systemic racism that are embedded in medical, social, and public health systems. So we're looking for, again, proposals that can describe approaches for studying system-level change, perhaps in addition to looking at change at other levels in the system, like the person level or patient level changes. As a S4A Action research program, we also place a lot of emphasis on proposals that can prioritize community-initiated and community-engaged study approaches and research approaches, including proposals that can incorporate individuals with knowledge of the communities that experience forms of systemic racism and individuals with expertise in approaches for dismantling forms of systemic racism within medical, social, and public health systems. And then finally, as I mentioned earlier, we place a lot of emphasis on studies and proposals that include a strong strategy for helping others access and use the results of their studies. So focusing in on research translation and dissemination strategies, including using strategies like designing for dissemination, described more in our funding opportunity brochure. And as I mentioned earlier, there are two categories of awards that are available for you to apply for in this CFP. And generally, you should pick which one of these two options really provides the best fit with your research idea and the stage of research that your research idea is currently in. The first category, as I mentioned, the developmental studies category, is for early stage research, for studies that are in an earlier stage of development. This category will provide up to $100,000 in total funding to support preliminary research activities, including pilot testing and feasibility testing of the proposed system alignment approach. These will be awards that are up to 12 months in duration, so the funding can be used up to a 1-year period to conduct the preliminary research and pilot testing. And the foundation anticipates awarding up to 5 studies in this developmental award category. The second type of award is the Impact Studies Award. This is an opportunity. This is an award category that provides a larger scope of research. Each of these awards will provide up to $500,000 in total funding to support research activities designed to estimate the impact of the proposed alignment strategy on forms of systemic racism and on the health of populations that experience those forms of systemic racism. This award category, the funding can be used for a period of up to 36 months or 3 years in duration to conduct the study. The foundation anticipates funding up to 4 studies under this award category. Very importantly, if you are interested in applying for the Impact Studies Award category, you will need to have documentation that your research team has already conducted some preliminary research on the system alignment strategy that you want to study. So you should already have preliminary research and pilot test results of your system alignment approach that document the feasibility of your approach and that document the acceptability of your approach to the key community stakeholders and collaborators you need to work with. So if you've already done that preliminary research, you've already done pilot testing and feasibility testing to demonstrate that your proposed alignment strategy is feasible for implementation, then you're well positioned. You're likely to be well positioned for the Impact Studies Award category. On the other hand, if you've got a system alignment idea, but you haven't yet pilot tested it, you haven't tested it to ensure that it's feasible and acceptable with your community stakeholders, then we'd encourage you to consider that first category of award, the developmental award category, so you can first do the work you need to do to ensure that your approach is feasible for implementation. And then the final point here down at the bottom of the slide, also very important. This is a research program, and so the foundation expects that the project funds will primarily be used by grantees to support research activities of the proposal rather than to support implementation activities of the proposed system alignment strategy. And so that's another important consideration to keep in mind as you're thinking about both of these award categories under the CFP. So just again, a few links to some key resources that we encourage you to spend some time with as you're considering this CFP and developing your proposal idea. The first is a link to the Robert Wood Johnson Foundation's webpage and a link to the CFP landing page for this Systems for Action research program. So from that landing page, you will find many of the other resources shown on this slide. But very importantly, you will find a link to the full funding opportunity brochure, to what you want to spend some time with. And also from this landing page, you'll see the links to the foundation's application and review system, the online system where you can use that system to actually submit your application materials. So definitely get to know the CFP landing page and the links and resources on that page. Number 2 is the full 11-page funding opportunity brochure. Again, that's available. That PDF document is available from the landing page. It's also available from our Systems for Action webpage. Very important that you download that and spend some time reading through that. It has more details about much of the information I just went through earlier about the special topics of interest, the requirements for proposal submission, and those kinds of things. Third, we have a Systems for Action frequently asked questions or FAQ page. Really encourage you to spend some time with that page as well. This is a page that we update on an ongoing basis as we receive more questions. We post more answers on that web page as well. So definitely, as you're developing your proposals, make sure to spend some time reviewing the FAQs there on our website. Fourth bullet point, also very, very important, are letter of intent templates. As we'll talk about in a minute, the process that will be used to submit applications for this year's CFP is a two-phase application process. The first phase, or the first step in that process, is submitting a 3-page letter of intent. And that letter of intent will be due on February 7th. We have a template. We developed a template for you to use to make it easier for you to develop that 3-page LOI and to make sure that you put all the information you need in that LOI. So we encourage you to download the LOI templates and to use those as you're developing your 3-page letter of intent. There are 2 different LOI templates. There's one for the developmental award category and one for the impact award category. Very, very similar. So we definitely encourage you to download those templates and use them as you're developing your LOI. The fifth bullet here is just another link to our S4A Research Agenda document available on our website that also provides some helpful information about, again, the purpose of the larger S4A program and the kinds of evidence we're trying to build through this program. Finally, as I mentioned earlier, also on our website, you can access descriptions of previously funded S4A research studies. There's a group of more than 40 studies that have been funded through previous years' CFPs, and so that may be helpful for you as well to get a sense of what other types of S4A studies look like and the other kinds of research that we funded to date through this program. A few other resources specifically designed to help you in developing your CFP application materials. One is to know that we are hosting weekly office hour sessions at the Systems for Action National Program Office. Every week we have an hour scheduled where you can drop in. I'll be there along with a number of other members of our National Program Office team, and we're just there to answer your questions about the CFP. We're there to give you any feedback or guidance that can be helpful to you as you're moving forward, developing an idea for submission for the CFP. Again, we do these every week. We'll host these office hour sessions every week up through the February 7th deadline. So feel free to join us. Information about how to register for those office hours is available on our website at the link that you see here. So definitely feel free to join us. Drop in at any time to ask your questions. Secondly, another really helpful resource, if you happen to be from a community-based organization, meaning not a university, not a research center or research institution, but a community-based organization, a nonprofit or a government agency or a professional organization. If you fall into that category, you can utilize a number of additional technical assistance resources that are available through our Systems Alignment Innovation Hub. This is an innovation hub that specifically provides technical assistance and support and guidance to community-based organizations and helping them develop their ideas, preparing their ideas for submission to research funding opportunities like the CFP opportunity we're talking about today. So if that's you, if you're a CBO or a nonprofit or another kind of non-academic, non-research organization, definitely feel free to get in touch with our System Alignment Innovation Hub. We've listed at the bottom of the slide a link to the Innovation Hub website, as well as the email address of the System Alignment Innovation Hub, hosted by our colleagues at TAC, the Technical Assistance Collaborative. So please make sure to use those resources as well. Our only caveat is don't wait to the last minute if you want to tap into the technical assistance provided by our colleagues at the Innovation Hub. Please reach out early if you want to take advantage of those supports. in preparing an application for this CFP application. Okay, next, I just want to go through a few other kind of technical details about the nuts and bolts of how to submit a proposal in response to this call for proposals application. Step number one, please carefully read that full funding opportunity brochure. This slide says it's 16 pages. I think it's actually only 11 pages. It's not quite that bad. But make sure you download that full 11-page PDF from the foundation's website. And you'll see that link that says view the full call for proposals. Click on that. You can download the CFP, read through that. Keep that handy as you begin to prepare your letter of intent. Also, make sure when you review that CFP funding opportunity brochure, there are a set of 6 selection criteria described on pages 10 and 11 of that document. These describe the criteria that the foundation and our National Advisory Committee will use to review and ultimately select applications for funding. So you want to keep in mind those selection criteria and what they are as you're preparing your letter of intent for this funding opportunity. Make sure that as you're writing your letter of intent, you're addressing those 6 areas of the selection criteria. And again, the letter of intent template gives you more information about kind of what to emphasize in your letter of intent. Since you are limited to only 3 pages, you can't describe everything. So we have much more guidance available in the LOI template about what information to make sure to include in your 3-page letter of intent related to these selection criteria. And that's the next slide, the letter of intent template. Please make sure to download that LOI template and use that to develop and write and submit your 3-page letter of intent. Again, there's 2 different versions of the LOI template. There's one for the developmental award category and one for the impact award category. They're very, very similar. But I encourage you to download those and use those as you're developing your LOI. They also have other important details like the font size and the line spacing and how you should handle references and citations. All of those, your margins that need to be set up. All of that is set up for you in the letter of intent template. So please download that and make sure to use it. And there's, again, lots of additional instructions about what to include in each section of your letter of intent. It'd be really helpful because I know it can be difficult to shoehorn in all the information you want to provide, and just with that 3-page limit. And again, this slide just kind of shows you some examples of what that LOI template looks like. There's 4 sections that are included in the LOI template, and we give you specific instructions about what to include in each of those 4 sections. We even give you suggested page limits for each of those 4 sections, adding up to the 3-page overall page limit. A few more details. Number 1, very important, who's eligible to apply as an applicant organization. The eligibility criteria are described here on this slide and also in the funding opportunity brochure. To be a lead applicant organization, your organization needs to be a public entity, a government entity, or a tax-exempt nonprofit organization under the 501c3 IRS code. Additionally, your organization needs to be based in the U.S. or one of the U.S. territories. Importantly, we do encourage multi-organizational consortia or collaborations among multiple organizations. That's often a really good way to approach a research opportunity like this. But if you are proposing something that is going to be implemented through a collaboration, you still need to select one organization to serve as the single applicant organization or the primary applicant, and make sure that primary applicant meets these eligibility criteria. A few more details about the application process. As I mentioned, it's a 2-stage process. The first stage of the process is submitting that 3-page letter of intent by the deadline of February 7th. It's February 7th at 3 p.m. Eastern Time. That is a required letter of intent that must be submitted through the RWJF online system. So again, make sure you keep that deadline in mind. Do not wait to the last minute to submit that letter of intent. As you know, internet problems can creep up, and also the foundation and we at the National Program Office will likely to have limited ability to help troubleshoot problems if you're right up there bumping against the deadline of 3 p.m. on the 7th of February. So please get in, access the RWJF online system early, get familiar with it, get familiar with the letter of intent template, and submit that letter of intent as early as you can, just in case problems crop up, with your internet connectivity or other kinds of things. Once letters of intent or LOIs are submitted, those will be reviewed by the foundation in our National Advisory Committee. A subset of applicants will then be invited to submit full proposals, and we anticipate issuing those invitations for full proposals on or about March 25th. And then for those applicants that are invited to submit full proposals, those full proposals will be due on May 22nd, also at 3 p.m. Eastern Time. And those full proposal materials must be submitted also through that RWJF online system. The full proposal materials will include a proposal narrative, a 10-page proposal narrative describing your research plan and system alignment strategy in greater detail. You'll also develop a budget and a budget narrative that describes how in greater detail how your organization will use the funds. It will include some other application materials as well, supporting documents like CVs or resumes for key personnel, a project timeline, letters of support from collaborating organizations, and for applications who are applying to the Impact Awards category, this will also be where you submit documentation of your pilot test results or preliminary research results to show that you are qualified to apply for that larger level of the Impact Award category. Once full proposals are submitted, those will go through a full review process. The foundation will notify applicants that are selected for funding, and then these awards are anticipated to start up by on or about September 15th of this year, 2024. So just briefly to recap some important dates to remember, February 7th is the deadline to submit your 3-page letter of intent by 3 p.m. Eastern Time. You want to submit that LOI through the RWJF online application and review system. And again, you want to use that 3-page letter of intent template to develop your LOI. March 25th is when we anticipate notifying which applicants have been selected and invited to submit a full proposal. Those full proposals will be due on May 22nd by 3 p.m. Eastern Time. And then the grants should start up on or about September 15th of this year. Okay, so that concludes the formal remarks of this webinar, and now we have time to entertain questions from those of you who are with us with the webinar today. We invite you again to use the Q&A box down at the bottom of your screen. Click on that Q&A box and you can type in your questions. We'll get to as many of these as we can in the next 16 or 17 minutes before the end of the hour. If we have not gotten to your question by the end of your hour, do not fret. We will respond to any questions we don't get to via email. We'll be emailing out answers to folks who have registered for this webinar. And we'll also add those answers to our FAQ webpage as well. So let me jump in. I see we've got some good questions already submitted. There's a question, are there examples you could share of specific forms of specific racism? Very good question. I would point you to 2 resources. Number one, There is a really helpful paper submitted by some colleagues, including authors at the Robert Johnson Foundation, specifically on this topic of systemic and structural racism, giving examples of forms of racism that operate, and especially forms of racism that operate and affect health and well-being. We have a link to that publication in the funding opportunity brochure. So we encourage you to read through that. It's got some great, very specific examples. Additionally, I would steer you to our FAQ page where we have additional examples and discussion of what makes for of forms of specific of systemic racism, and examples of forms of systemic racism specifically that operate through medical, social, and public health systems. So you can see some good examples in the publication, the Health Affairs publication that is linked in the funding opportunity brochure, and also in our description on the FAQ page. However, I would say don't limit yourself to just those examples in our descriptions. We are open to your proposals, your ideas about forms of systemic racism as well, and about potential solutions. So very, very good question. Please take a look at our funding opportunity and our FAQ page for more information. And also feel free to drop in to our online office hours, and we'll be glad to have larger discussions about that issue as well. Question about whether we define systemic racism as different from structural racism. We use these two terms pretty interchangeably in the CFP document, and again, encourage you to read through that 11-page CFP document where we've got more detail about how we define these two terms. There are some subtle differences that are noted in the Health Affairs publication that we link to in this CFP document, but I think how we're using those terms, or basically use those terms fairly interchangeably. We do tend to use the term systemic racism more frequently in the CFP document because we focus on systems in the S4A program, and we're especially, again, we're interested in studies to address forms of systemic racism that are embedded and or that operate through or affect medical, social, and public health systems in this call. But really, practically, we use these terms interchangeably in terms of systemic racism and structural racism. Question about what would be suggested as a split of budget between research activities and implementation of the strategy being studied. I can't give you a recommended split, although I can say that this is a research program, so really the funding is designed primarily to support your research activities. I would say if you're needing to use a lot of the grant funding to support implementation of the system alignment strategy, that's likely to place you at a competitive disadvantage for several reasons. Number one, the more resources that are kind of sucked away into implementation, that means that you've got fewer resources available to support a robust research proposal, and that is the major focus of the Systems for Action research program. Secondly, if you're relying on research grants funds to support your implementation of your alignment strategy, that often can raise questions about the sustainability and scalability of the strategy you're proposing. So we, again, really encourage you to look at ways of using the research funding from this grant opportunity to support your research, studying the implementation and or the impact of your alignment strategy. Next question. We get this question a lot. Is this program going to be offered again in the future? Well, I can say, again, as I mentioned earlier, our program has been around since 2015. We have published annual CFP opportunities every year, beginning in 2016 up through last year's 2023 call for proposals. So this program has been operating on a cycle of producing annual CFP research opportunities. as always, the decision about future research opportunities is in the hands of the Robert Wood Johnson Foundation. That decision hasn't been made yet, but we do anticipate a strong likelihood of the S4A program releasing future fall call for fund CFP opportunities in future years. That certainly has been our pattern over the history of the program, and we do expect that to continue, subject to decision making at the Robert Wood Johnson Foundation. Question about are you allowed to submit more than one LOI? I would say we've got a great answer to this question in our FAQ page, so I encourage you to take a look at that. The short answer is you should really, it's only appropriate to submit more than one LOI if your two LOIs are describing very distinct and different research proposals. You should not be submitting multiple LOIs describing the same basic research project. I'd also say it's fairly unlikely that the foundation would support more than one grant application from the same applicant organization, just given the breadth of research that's being called for in this call, and the fairly limited number of funding opportunities, studies to be funded here. So it's unlikely that a single applicant organization would receive more than one grant, funded grant on this award opportunity. So I encourage you to kind of look at your idea and decide which opportunity is best, which LOI is going to be best, the best opportunity for your idea. If you do have really multiple research ideas, very distinct ideas, you could submit more than one LOI, just recognizing it's unlikely that multiple LOIs would be funded from the same organization. Okay, question about who is eligible to apply. Can a for-profit apply? Again, I had a slide earlier in the webinar about that. For-profit organizations are not allowed to serve as the lead applicant organization for this EFP. For this CFP, you need to be either a public entity, a governmental agency, or a tax-exempt nonprofit organization to be eligible to serve as the primary applicant organization for this CFP. Question about would applications tackling gaps in current strategies for addressing food insecurity be acceptable for this application? I would say certainly. Food insecurity is a major driver of health and well-being, and I think to the extent that there are forms of structural and systemic racism that are driving problems with food insecurity, and that your application will be proposing a system alignment strategy to address those forms of structural and systemic racism that are causing food insecurity, that could be a responsive type of application. And also, I would say, as long as also your solution you're testing would be engaging medical, social, and public health systems, representatives from all three of those types of systems, then that could be an application that could be very, very responsive to the CFP. Next question about special topic number 1. This is, let's see if I can read through to get the crux of the question. I don't see a question in here. It looks like this is just a restatement of our special topic number 1. So if you're the submitter of that question, you want to submit a little more detail about what question you have about that topic number 1, we'd be glad to respond to that. And I would point out that we do have some additional language on our FAQ page that provides more information about that topic number 1. And again, topic number 1 in the CFP is for studies that are designed to help expand our understanding about specific forms of systemic racism and the opportunities for disrupting or dismantling them. Let me see, moving down our list of questions. Oh, I see. Okay. Yeah. So, okay. So, question about um, proposals submitted under special topic number one. And we have some language that if you are submitting a proposal under topic number one, your study may not be focused on testing the impact of a specific system alignment strategy. Well, that's because if you read special topic number one, um, it's not about testing an alignment strategy. It's about studying a form of systemic racism in greater depth, addressing gaps in our knowledge about that form of systemic racism in order to eventually produce new evidence that can help to inform new strategies, new alignment strategies that could address that form of racism. So that's the real crux of special topic number one. Proposals submitted under that topic are really designed to help us better understand forms of systemic racism rather than testing system alignment solutions to those forms of racism. So that's the real difference between topic number one and other topic areas in this CFP. Again, you're studying racism and generating evidence about forms of racism rather than testing specific solutions to those forms of racism under topic number one. Very good. Next question. This question says you've got reports that your system alignment strategy works on certain health outcomes for minority communities, but you want to test novel financing mechanisms to allow for sustainability and expansion. Would that be allowed under topic number two? Absolutely. That sounds like that general topic you described sounds like it could be a very, very responsive to the special topic of interest number two, in testing a novel financing mechanism for an alignment approach that you already have been doing some studies on in terms of testing it with different communities. Very good. Question, if you're a nonprofit that provides a social service and that also has a research department, can your research department conduct a study of your own operations? Short answer is yes. Yes, you could certainly do that. If you've got again, an internal research operation, then you may not need an external research partner to pursue this funding opportunity. Would say, we've got some additional answers on our FAQ page about that situation, about helping you think through, do you need an external research partner or not, or what would be some of the advantages of having an external research partner to collaborate with on this funding opportunity. So we encourage you to take a look at the FAQ page as well. But certainly, if your own organization has got adequate research expertise, you don't necessarily need an external partner for that piece in this for this CFP. Question about a project that deals with a condition found in a racialized group that has not received much attention in the medical community. You've got preliminary data and community partners, but cannot show that the negligence is due to racism. So ideas there. I would say, yeah, if you've got a problem that affects a racialized community, but there's uncertainty about how and whether systemic racism is how it drives that problem, then probably your research idea would fit more into that special topic of interest number one, where we're calling for studies that help us better understand forms of systemic racism and how they affect populations, how they cause health problems. So I might steer you to thinking about special topic number one, and whether you could design a study to again shed more light on the connection between systemic racism and that cancer-related health problem that that affects the racialized group of interest to your community. Let's see. I'll do one. We've got time for one more question. Again, if we haven't gotten your question by today, we'll be following up with you with answers to other questions submitted today. This is a question about linear logic models, often poorly aligned to develop evidence around systems change. We couldn't agree with you more. Dynamic forms of systems models can be very helpful there. We are very open to system dynamic perspectives, very open to proposals that use system theory and systems methods as as part of their approach, and applications that use systems related theory related to field of complex adaptive systems in your work. So definitely those theories and methods and approaches can be very relevant to the study of medical and social public health systems and their work to respond to systemic racism. So we definitely encourage you to do that. Again, we are at the bottom of our hour, so I want to thank all of you for joining us. I apologize if we didn't get to your question yet. We will be following up. Please feel free to access the recording and our slides for today. Please feel free to drop in on our weekly office hour sessions and ask questions, or send us an email to the S4A National Program Office, and we'll be glad to further interact with you. We hope to receive an application from you on the letter of intent deadline by February 7th. Thanks so much, everybody.